Are cancers lifestyle-based diseases? The answer is yes. Namaskar. I'm Dr. Tapaswani Pradhan, working as a head and neck cancer surgeon at the Indraprastha Apollo Hospital, Delhi and Apollo Hospital, Noida. Friends, 40 to 50% of the cancers that we see are highly preventable. That's because they are all lifestyle-based. From the mid-20th century, we have been seeing a gradual increase in the incidence of cancer. With urbanization and commercialization, we have added a lot of comfort in our lives, but then we have also carried the baggage of diseases. Lives have become sedentary and has become more stressful. We have added new habits to our own life to take care of the stress. We've moved away from nature. As we have moved away from nature, we have become closer to medicines. What habits are we talking about? And that is tobacco. Tobacco, alcohol, pan masala have been major contributors to the rise in our incidence. 25% of the cancers in females are tobacco-induced, while 50% of them in males are again tobacco-induced. If you look at the most common cancer which is there in our country, which is the oral cancer, 80% of them is because of consumption of either the chewable or the smoked form of tobacco. So has our dietary pattern changed? And I think the answer is yes. To cope up with the fast pace of our life, we have taken more to fast food, processed food, junk food. It's easy to consume, it also tastes good, but it's injurious to our health. Exposure of various chemicals, either through our occupation or through our environment, exposure to pollutants like diesel, smoke, or the petrol. And in occupational hazards, people working in industries like wood industry, leather industry, dye industries, smelting industries, paint industry, all these individuals are exposed to toxic chemicals which are injurious. Physical inactivity. We often don't take time for ourselves to engage in these physical activities. And that's the reason why obesity is on an increase, which has led to a lot of hormonal imbalances, insulin resistance, and also increased inflammation, contributory to the causation of cancer. Stress, my friend, again, is become a part of our lives, but stress can also be stressful and injurious. It is known to promote cancers, it is known to promote the growth of cancer cells and also the spread of cancers. Sleep is not a luxury. Sleep is essential and it should be a part of our lives. A healthy, good, and a sound sleep relieves the body of a lot of toxins and frees us from a lot of diseases. So understand, friends, how habits influence our cancer risk. So move on to healthier choices and reduce the risk of your cancers. Thank you so much.